They get a report, and they have started. They said, we started at 4 o'clock. We started this 24-hour urine, and so I'll say, did you discard that one? No, don't. We started it. That's so wrong. The urine started at 4. If they urinated in there, was urine that was made earlier. And nurses used to make that mistake a lot. But just keep in mind that they void and you throw it away, but it started then because that urine had been made before 4 o'clock. So it's just a little something that makes you good or not. Blood administration will be on the IV day. And the next page, page 6 as well. And then just data. I have a little line at deep breathe and cough. It's just people in the hospital don't deep breathe unless you ask them to, or if they're running steps or walking real fast. They just don't. And those are the only times you and I breathe deep. We run, we do steps, or we purposely do it. So we really need to do it to expand those lungs. And I've noticed when I have, and when you assess a patient, it's a good time to have them do it. And if you stand at the foot of the bed and say, now fill up your lungs as full as you can get them, hold it, push it out, and now push it out. They'll cough. Well, they cough because it's been stale and it's just sitting. So I just can't emphasize that enough. The next page, page 8, I marked a little mark on measurements. Just some that, those are about all we need to know. A cup of ice is 120 because a coffee cup's about 240. And if, so if you did a cup of ice, 240, it really is 120 when you're doing eyes and O's. And you see, just keep in mind, 1,000 micrograms is 1 milligram. And the other big one is 60 milligrams is 1 grain. And a teaspoon's 5 milliliters. Okay, page 9. We know the roots are, of course, rule out. We know this may be a patient's problem. In the medical community, ruling out means they possibly have that. We're going to try to rule it out. Roots, per PT, per tube, by tube, PO mouth, PR rectum. And the self-intermittent catheterization, SICK, patient doesn't have to use sterile technique. The nurse does not use sterile technique. We do some in the hospital, but it's frowned upon because we're so full of germs. There are people out there that do their own catheterizations. Now, I don't know many that don't keep a chronic urinary tract infection. And I've asked them ones out in the world when they're doing it. I say, do you not have a lot of infection? All the time. And why that's all right, I don't know. But I think physicians feel it's better than keeping a meatus open with a tube all the time, that a bag can travel germs. It's worse that. Statistics say that we'd all do better to do self, even at the hospital, than the bag and the catheter, because it is open. Your bladder is open with the tube, and here's this cooking urine every 8 hours that the germs work up. But in the interest of time, nurses just can't do this. I mean, patients can't do them, and nurses hadn't got the time to do them either. So we do Foley's. Always bite your tongue if home health or any place you suggest know what you're suggesting if you say, can we put a catheter in? And of course we love it to not have to keep changing the bed. But is that really good for the bladder? But is it good for skin to lay in urine depend? So it's just really a thought, but all I'm saying is think about it. Page 10, I can't emphasize at the bottom scales enough of weighing patients. I feel for physicians because I think we're not real good at it. The beds now have a lot of scales on them. Just push the button. But does it have as much linen as yesterday morning? Or did they get cold in the night and they have 2 blankets on there this morning? So I feel for physicians when they're trying to gauge their medicines by our weights. Same scale, same time of day, same clothes. Then page 11, the TED hose. The thromboembolic decompression stockings, the purpose is anti-embolotic when patient is bedridden. When I'm ambulating, these are support hose. Should be removed for a minimum of 5 minutes to a maximum of an hour and replaced every 8 hours. Best to replace TED hose after legs have been elevated and patients back to bed. So here's the deal. If it's for anti-embolotic purposes and they're never getting up, you take them off, because when you and I walk, our veins are getting exercise. The muscles are squeezing them. And so they're getting toned. That's why it's so wonderful to walk, because it's toning our vascular system. But if you have surgery, you just lay there. Somebody did scientific research and said, really, all you need to do is one time in 8 hours, put a hose on, take it off. And I wrote there 5 minutes to 1 hour. You can leave them off 2 hours. The whole point is one time in 8 hours, make sure they have had some isometric. Put them back on. Now that's for anti-embolotic purposes. Then I said if they're ambulating, just call them support hose. They really don't need them. Do you understand? If you're ambulating, you're doing far better than that hose. But they still do them. So call them support hose. And of course you've got to take them off to bathe the legs. But if they're sitting like you're sitting now, and you take them off and wash those legs and put some lotion on them, dry them, they need to be back in bed, so the pooling that happened, you don't put hose back on engorged veins. How much harm do I think is done? I don't imagine there's a lot, but it just is a good thing to do, to not put the hose on till they've been at least 5 minutes in bed. They can be an hour. Sometimes when I put a patient back, the family will say, you didn't put the hose back on. And that's when I'll say, I'm going to try to remember, but in about 15 minutes, look for me out in the hall and remind me to come in. I'm going to try to remember it, but if I can't, because I want the blood to get back out of the pool from sitting. So, when ambulating, these are support hoses. Should be removed for a minimum of 5 minutes to maximum of 1 hour and replaced every 8 hours. Best to replace TED hose after the legs have been elevated. So, I've mentioned anti-embolotic, I've mentioned support hose, then after they're, well, what did it say, 2 weeks? Yeah. 2 weeks, they're nothing but socks. Mm-hmm. And I talked to, it doesn't matter, I want to say Hayes, on Hayes Street, one of those, one of those supply houses, medical supplies. And I talked to him about TED hose and said, if we wash them, their life, they're obsolete in 2 weeks. That's why I call them socks. I said, if we washed them out good and towel dried them and left them in the bathroom, will it increase their life? No. She said it will not. They were meant for 2 weeks, and that's all. And so, I mean, you can teach that if you want to. And as I said, if they're putting weight on their legs, they don't even need them. But now, ease into me. I've also been to those houses to talk about hose because I'm on my feet. With students, I'll hardly sit down for 12 or 13 hours. And so I want a real good hose. And I think it's just good to know. Any nursing you do, and unless I teach, I don't need this because I sit down. Nurses do sit down, you know. They don't all just stay up as long as I do because of students. But, so you probably don't even need to worry about it, but I did, and I didn't want varicosities. So I went to the supply house, had to talk to them. And for $150, I buy these hose. But I'm pretty religious about it. You put them on, as soon as the alarm goes off, you put the rubber gloves on and put them on your feet. You've had 7, 8 hours for your legs are been this way for 7 or 8 hours. You put those hose on, it's good, secure. When you take them off, you wash them with their special soap. Now, all you do is soak them for 20 minutes, then rinse them in cool water and towel dry them, and never, dry them anyway, but towel dry. They'll last a good. They want you to buy them every 6 months. I don't. I'll go a year.
How many pairs do you get for that price? I'm sorry.
Do what?
You said $120 for one pair. How many pairs do you get?
That's 150. Sometimes they'll do a break and let you have them for 120. But
one pair. Those are some really expensive hose.
That is expensive hose, but
I thought maybe you did a package.
No,
because I was like, that's a lot of money.
No, one hose.
All right, okay.
But they are wonderful and they're so secure, and I don't think my legs are bulbous with varicosities for that reason. Now, I want you to go to bottom of 10, sequential compression device, SCDs, sequential compression device. Here's the deal. They're those plastic wraps around the legs that has the motor. You push it. The idea is great. It's doing walking. It squeezes, it lets up. It squeezes and lets out. Somebody had a clever idea, but I've been told that there's no scientific research that it's any better than the once every 8 hours. And you don't have to pay the rent, and you don't have, they're hot. And they kind of limit your in and out of bed because they're on the machine. You have to undo them and get up and go to the bathroom and come back or whatever. But now if you're intensive care and doing it, it's probably okay. Also, when you assess a patient and they're bedridden, whether you're doing home health or anything, if you'll have them push their feet against your palms, that's doing some of that. So anything to keep clots from happening. But the sequentials, I told this doctor, I heard him telling the patient, I was in with a student with an IV, and I heard him say, so after surgery, you're going to get, which is just drives me crazy, because surgery will put sequentials on, they'll put TEDs on, and the sequentials on top of that, which is just silly. So he's told him that. He told, you're going to get the hose, and you're going to... So when I left the room, believe that. There's no scientific research on that, by the way. And he came out of the room when he got through. He didn't rush right out. He said, "What are you talking about?" I said, "There's no scientific research." He said, "Oh, there is. You go down to the operating room. They can tell you. They've done stuff." Well, I had a student go do the research. She said, "No, they don't have any more than we do." So when he came back, I told him that. And he said, "Okay, all right, I'll buy it." But nurses don't do that. They don't do them right. They don't make people, they don't take them off and pull the, nurses don't do it. I said, "Okay, I'll go with you on that." They're not as careful. That's just good nursing. And a lot of times nurses just get the job done. Take them off, take a bath, put them back on. That's it. So sequential compression devices. Now, page 12, IV infusion information. We'll talk about that when we do IVs. And that will be 13 and 14. And then 15 are labs. And we're going to do a day, remember, on labs. And then starts our medication. And they go on over to, because we're going to go over those, we don't need to do it now. 22. And on 22 starts nutrition. And we'll do a little bit of session on nutrition. 24, I don't have many. That's your equipment. So are we spending 3 hours on this? No, we'll do other stuff. I'm going to talk respiratory plus the equipment next week. There's your midway is your Pluravac, Dr. Orcutt's article, plus your visual of it. Page 25, 26, 27 are terms. Look at 27, you see VRE, vancomycin-resistant enterococci. We've already spoke of MRSA, but more serious. And Zyvox is the drug that's so good for VRE. And then the last page is, again, something you would never have to memorize, or nurses don't either. But if we needed to run a potassium or a B, we're going to talk, this is more lab day, but do you remember maybe you don't, SMA 12 simultaneous multiple analysis, 12 tests in 1 tube of blood. It's been changed to comprehensive metabolic panel, and that's the 12. The basic metabolic panel was your SMA 6. And so there they are down there. There may be 7 of them because they add 1 occasionally. So the complete metabolic panel or comprehensive metabolic panel is the BMP plus total protein, albumin, calcium. CBC I think it's such a misnomer. Complete blood count, it's not. It's just hematocrit, hemoglobin, white, red. Some places include platelets. I think Vanderbilt includes platelets. We don't here. They have to say CBC and platelets. All right. So that does that. And how's my time? I've got 15 minutes.
Yes.
Okay. Now, I want you to write down, because I'd love for you to watch it sometime. Again, I don't test you on stuff, because I think you're interested in learning. And I'm going to have to find, I tried to find it earlier. There's some things that I think are good that I want you to have a list of. You don't even have to do it, especially while you're taking this course. But I think, I have a list if I can find it. If I can't, I'm going to have to commit from memory. And I may miss something, and I'll have to come back next week with it officially. There is you can Google it. I think the name of it is I'm a Nurse. I'm a Nurse. And it's about 10 minutes, maybe 8 minutes. No, I don't know how long. It's not long. But it's really good. You don't have to pay for it. But it is, it really makes you, I think it's a great profession anyway. But after you watch it, you just think it is a great profession. Gives you a lot of pride. I'm a nurse. There's one that, the Josie King story, Josie, the Josie King story. It's 8 minutes. And it,
Josie, Josie.
Josie.
Okay.
Oh, I found my list. It really helps us realize how we need to keep on thinking and details. And I think that's what this course is about, to remind you of, refresh you on how important details and things like that are. The Josie King story, the mother tells the story of Josie King. She got burned in the bathtub and went to the hospital and died because of it. It wasn't because she had a burn. It was mistreatment, electrolytes, fluids. She got where she was so thirsty she was sucking her bath cloth. They were taking a bath and sucking the water out of there. And they just, I don't know, communication, it just shows that communication. And she, Josie died, and she tells about it. And it was actually she had talked to a small group of physicians, and they asked her to come back to a big convention. She didn't know if she could do it, but she did. She's on a circuit now, Laurel King speaking. She said after the death, she didn't want to do anything but blow up the hospital and kill, and realized if she did that, of course she would die, but she'd leave her 3 children. She said, one day I'll tell them they saved my life, and decided to turn it into something good. And she was worked real hard, she and her husband, on safety in hospitals. And it's a great story, and it's 8 minutes. Then, Glory Enough for All. Glory Enough for All. That's longer. It's a feature film. It may be on Netflix or one of those, but it's a story of the discovery of insulin. And you think, I know one holiday I had my family, we were off on a vacation. I told them I had a great video to show them. What about discovery of insulin? Oh, it's what everybody wants to watch on a holiday. But it is that good. And I'm going to talk about that when we also, not about that movie, well, parts of it, when we talk about diabetes. You need to clear up. It's not I'm a nurse. It's a nurse. It's a nurse. It's a nurse. Now, another one, and you may not get to all these during this course or even want to. Just keep the list for sometime. Another is a movie, Netflix or someplace, WIT, W-I-T. And it is a woman who makes you really, she's dying, realize what we do and say to patients that are just almost asinine. And she when a nurse walks in and says something, she tells the audience what do you mean? Da 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 da. And it just focuses you into what are we really saying and doing. So I think these all are good to kind of make us raw. We need to be raw occasionally and more thought. I'm not these, see the others before these, but they're okay. What the health? What the health? And then that sugar film, that sugar film. Supersize. How is that?
It's wild.
Makes you not want to eat it.
Yeah,
Really?
I haven't since
Which I don't anyway, but
Yeah. I had watched it. Those have been suggested by refreshers, and I just hadn't gotten to them. Prescription for danger. Prescription for danger.
I just really feel like if they can't advertise alcohol and tobacco, they should be able to advertise drugs.
Yeah.
You know, it's just really bothers me that it's illegal to advertise.
Oh, now that's a good point.
I mean, I've complained to my representatives about it.
Have
and
you really?
Nobody cares. Believe me, nobody cares.
There must be big bucks
It's
in
big
it.
money.
But you're right. If we can't do tobacco and no,
What's the difference? I mean, all the drugs are as harming as the tobacco.
that's right.
So,
That's
I
right.
mean, maybe.
And misused. Yeah.
Oh, yeah.
Yeah, that's interesting.
I think the other side of that, though, is there are good uses for medications,
Yeah.
and there's not.
Well, that's a
There's
good
not
point.
a medical use for
Mhm.
tobacco, so
Yeah.
I mean, I think that's there.
They're thinking.
Just
I live in Wilson County, that's a great area.
oh,
All the farmers.
huge job.
Now, go on and write these down again, just to have in your portfolio. WBC, capital W, capital B, capital C, chase bacteria. I hadn't seen these, but refreshers have told me how great they are. The Lewis, Lewis, Lewis Blackman story. Lewis Blackman story. Linda, and the other one, Linda's story. Uh-huh. Death by medical errors. And it has semicolon Powell, Powell. I don't know why, but. Medication safety, semicolon. No, colon. 2 dots is a colon, isn't it? A patient's story. Medication safety, a patient's story.
And these are all movies, like full
Huh?
films, or
Do what?
are they all movies?
I think so. Or at least,
Yeah, like
I don't think
it's
they're
a nurse is like on YouTube. It's
Yeah.
a short one. Like,
I don't
Some
know
of them
that
are.
they're all featured. I mean, I do know Wit and the other one I told you are movies.
Wit is on Netflix.
And Glory Enough for All. The others may be little things. Do No Harm, Jess story, Jess story. And the last one, novice nurse makes a medication error. Novice nurse makes a
That almost sounds naughty, I'm sorry. Novice nurse makes
Makes
medication
medication
error. Okay.
Just keep it kind of